If you are approaching age 65, or if you are already there and navigating retirement, I want you to stop whatever you are doing right now and look at me. We need to have a serious, sister-to-sister, friend-to-friend talk about the single most important safety net of your retirement years, Medicare. I know what you're thinking. You're thinking, Susie, I've worked my entire life, I've paid my taxes, and Medicare is just going to take care of me when I turn 65. Wrong. That is a mistake, a massive, potentially devastating mistake that could wipe out your hard-earned retirement nest egg in the blink of an eye if you do not understand how the system actually works. Medicare is not a single, free health insurance plan. It is a complicated, multi-part puzzle, and if you put the pieces together incorrectly, you are going to pay the price. And I do not want that for you. I want you to be safe, I want you to be secure, and most of all, I want you to be protected. So let's break down how this works, what you need to fear, the questions you must ask, and exactly what you need to do today. Let's start with the basics. There are two main paths you can take when you enroll in Medicare. Path number 1 is Original Medicare. Path number 2 is Medicare Advantage. These are two completely different roads, and choosing the wrong one can lock you out of the care you need when you need it most. If you choose Original Medicare, you are dealing directly with the federal government. It is broken down into parts. First, you have Part A. This is your hospital insurance. It covers room and board if you are admitted to a hospital, a skilled nursing facility, or if you need hospice. For 99% of you, Part A is free, meaning you don't pay a monthly premium because you already paid for it through your payroll taxes while you were working. You pay a monthly premium for this. The standard monthly premium is just over $200. If you are collecting Social Security, that money is automatically deducted from your check. Did you hear what I just said? 80%, that means you are responsible for the remaining 20%. And under Original Medicare, there is no limit. Let me repeat that, there is absolutely no out-of-pocket maximum on that 20%. If you get hit with a serious illness and your cancer treatments cost $100,000, your 20% share is $20,000. That is a financial nightmare that can destroy everything you worked so hard to save. To protect yourself from that 20% gap, you must buy a Medicare supplement insurance policy, commonly known as Medigap. Medigap is sold by private insurance companies, and it steps in to pay that remaining 20% so you aren't financially ruined, but we aren't done. You also need prescription drug coverage, which is Part D. Again, this is a private plan you buy to cover your medications. There is a maximum deductible of $615, and thanks to recent laws, your annual out-of-pocket drug costs are capped at $2,100. This cap is a major blessing, but you still have to shop for the right plan to make sure your specific drugs are on their list of approved medicines. No networks, no referrals, no insurance company bureaucrats telling you which specialist you can or cannot see. It is ultimate freedom, but it comes with multiple monthly bills. Now, let's look at path number 2, Medicare Advantage, also known as Part C. Every single day, you are probably bombarded with commercials showing happy seniors playing golf, promising you $0 premiums, free dental, free vision, and even money back on your Social Security check. People, please, listen to me. If it sounds too good to be true, it usually is. Medicare Advantage is not a government program. It is private, for-profit insurance. When you sign up for Medicare Advantage, you are handing over your Medicare benefits to a private insurance company. They get a lump sum from the government to manage your care, and their goal, make no mistake about it, is to make a profit. Yes, they bundle your medical, hospital, and drug coverage into one neat little plan, often for a very low monthly premium. But how do they save money? They limit you to a strict network of doctors. If you want to see a specialist, you usually have to get a referral from your primary care doctor first. And if you want a critical test, a scan, or a surgery, the insurance company will often require prior authorization. That means a bureaucrat sitting in an office miles away gets to decide if your doctor's recommendation is actually necessary. The biggest fear with Medicare Advantage is what happens when you get sick. When you are healthy, a $0 premium plan feels great. So, how do you decide? What is the actionable takeaway for you today? First, look at your health, your budget, and your desire for freedom. If you want total control over your healthcare, if you travel frequently, or if you want the peace of mind knowing you can see any doctor in the country without an insurance company gatekeeper, you choose Original Medicare paired with a Medigap policy and a Part D drug plan. Yes, your monthly premiums will be higher up front, but your out-of-pocket costs when you get sick will be practically zero. You are buying certainty. If you are on a very tight monthly budget, cannot afford the Medigap premiums, and are comfortable staying within a local network of doctors and getting pre-approvals for care, then Medicare Advantage might be a path for you. But you must go into it with your eyes wide open, knowing the potential roadblocks if you face a major health crisis. Second, mark your calendar. Your initial enrollment period is a 7-month window. It starts 3 months before the month you turn 65, includes your birthday month, and ends 3 months after. If you do not sign up during this window, and you do not have qualifying health coverage from an active employer with 20 or more employees, you will face lifetime late enrollment penalties on Part B and Part D. These penalties do not go away. They get tacked onto your premium every single month for the rest of your life. Do not let laziness or confusion cost you thousands of dollars. My friends, healthcare is the single greatest threat to your financial freedom in retirement. Do not treat it like an afterthought. Take control of your money, take control of your health, and make the choice that allows you to sleep peacefully at night. You can do this. Stay safe, stay strong, and be secure.